This presentation is about Western St. Petersburg, presented by Andrew Mills, Brian Hevron, and Maria Catalano. Objectives for this presentation will be looking at the history of St. Petersburg, community analysis, looking into the structure, population, healthcare resources and availability, the environment, and government, the prioritization of community problems, and the global community problems.
General background for the city of St. Petersburg is it is the largest city in Pinellas County. It's the second largest city in the Tampa Bay metropolitan area. It's popularly known as the Sunshine City, and it's a popular tourist destination and popular with retirees. The city of St. Petersburg was initially settled in 1875 facing Tampa Bay. It was more formally founded in 1888 by Peter Demons, a Russian emigre, and incorporated as a city in 1903. Railroads spurred initial development in the late 1800s, and with the advent of car travel in the 1920s, there was an increase in tourism and visitors. St. Petersburg was largely agricultural until World War II. World War II brought new increased growth and opportunity with military and wartime investment in the area. Post-war, the city of St. Petersburg grew westward toward the Gulf until the area was fully urbanized by the 1970s. There are numerous places of worship throughout western St. Petersburg. These and other local places of worship offer a variety of social services such as food pantries, schools and preschools, financial assistance, homeless shelters, soup kitchens, and Christmas toy drives, amongst other services. There are numerous major thoroughfares throughout Western St. Petersburg. Western St. Petersburg is serviced by the Pinellas Suncoast Transportation Authority, PSTA, bus service. There are also numerous taxi services and volunteer transportation services.
Population over 65 within this area is 15.7%, under 18 is 19.5%, employed individuals is 57.8%, unemployed is 5.7%. Receiving supplemental Social Security is 5.5%, cash assistance 2.6%, and food stamps is 14.8%. Education level at high school or below is about 1/3 of the population. Demographics within this area is white being 68%.
From the road, most houses in western St. Petersburg appear to be in good repair. Neighborhood associations are active and neighborhoods are often clearly demarked with distinctive monuments. Total units of housing in St. Petersburg are a little less than 130,000. Owner-occupied homes are 57.3, renter-occupied housing is 26.8, and vacant housing is 15.3%.
Concerns within this community: disease and health. The number one communicable disease within this area is sexually transmitted diseases, estimating about 3,000 per 100,000. The leading cause of death for this area is cancer and heart disease, both respectively about 22% of the population.
St. Petersburg General Hospital serves as both an outpatient care facility as well as an acute care facility. This facility specializes in orthopedics, obstetrics, robotic surgery, and urology services. Pricing for this facility will depend on services obtained, type of insurance, and length of stay. The two mental facilities within St. Petersburg work with children as well as adults suffering from mental illnesses and provide behavioral health testing, trauma services, rape intervention crises, and private and group counseling sessions. Prices will vary for these locations based on services obtained and the type of insurance the patients have. Low to no cost services may be available to those who qualify through resource programs. There were 2 walk-in clinics within the vicinity made available to those who have health insurance as well as those who do not have insurance. Services offered include sports physicals, x-rays, non-narcotic medication dispersals. Prices will fluctuate but will usually range between $100 to $150 for those without insurance to be seen. Skilled nursing facilities, assisted living facilities, and rehab facilities were the prominent health resources within St. Petersburg. Patients requiring rehab therapy, around-the-clock medical assistance, and those who cannot safely reside by themselves anymore will seek out these services. Pricing will be dependent on length of stay, services required, and type of insurance held by the patient. Women's Care Florida provides gynecological services, mammograms and screenings, immunizations, and obstetrical services to females of all ages. Home Instead Senior Care provides an opportunity for the elderly to still live at home. They offer companionship care, meal preparation, and transportation. Though Planned Parenthood is not located within our parameters, it is an excellent social service provided to those of all ages who do not have health insurance and are not comfortable explaining their personal health concerns to their families. This facility provides sexual education, STI testing and treatment, and obstetric care as well as family planning. The cost of these services provided at these facilities differ from patient to patient, and free services may be made available to those who need it. The following Healthy People 2020 objectives were chosen for residents of Western St. Petersburg. Initiative C20 works at reducing harmful UV rays. This initiative is important because Florida is notorious for being the sunshine capital of the world. This objective will encourage council members to come together and develop programs on ways to prevent unprotected prolonged UV exposure as well as the consequences and its direct correlation to cancer. Objective HDS 2 and 3 discusses ways to reduce deaths associated with heart disease and stroke. According to the Florida Department of Health, approximately 25% of people either suffer from heart disease and/or stroke within Florida alone. This is believed to be due to poor dieting regimens, physical inactivity, and tobacco use and alcohol abuse. Lastly, Objective TU1 discusses the need to reduce tobacco use. This is a pertinent objective as council members can create educational tools for addressing the consequences of using tobacco, such as COPD, lung cancer, heart disease, and stroke.
Environment. This area offers multiple parks and recreational services for individuals. Within public works, you have water, sewage, and waste, which is all offered to the public as well. And also, police and fire departments are scattered throughout this community, offering services to individuals. Concerns for this area. There are a minimal number of bike lanes offered for those who ride a bike, which increases the risk of being hit by other motor vehicles. Sidewalks are very few in some areas, but they're also plentiful in others. Roadways are constantly being worked on, which increases accidents throughout this population as well.
The elected city officials of St. Petersburg are the mayor, deputy mayor, and the 8 members of the city council. The mayor is term limited and may serve only 2 consecutive 4-year terms. All elected city government officials are nonpartisan. The mayor's office includes most of the departments of the city government. The mayor and the departments under him enforce city codes and city laws. The mayor's office proposes the city budget. The second major branch of St. Petersburg government is the city council. The city councilmen are nonpartisan. City councilmen are elected to serve 4-year terms. The city council legally has all legislative powers in the city, meaning the city council creates and enacts city codes and laws and approves or disapproves the mayor's budget proposal. The general fund revenues for the city of St. Petersburg in 2017 is a little over $235 million. The total operating budget for 2017 totals a little over $514 million. The large majority of the budget is related to personnel costs, approximately 68.3% of the budget. There is currently an anticipated budget shortfall of a little over $4 million. This is the difference between the total revenues and the total expenditures. The 5 largest categories of employers within St. Petersburg are 1. Professional and business services, 2. Education and health services, 3. Leisure and hospitality services, 4. Construction, and 5. Retail trade. Total city general fund revenues for 2017 are a little over $231 million. The city's main revenue sources are taxes at about 70%, intergovernmental revenues at a little over 11%, and other revenues at a little over 10%. Major future spending initiatives for St. Petersburg include a new municipal pier, keeping Major League Baseball, the Tampa Bay Rays, creating new retail areas, building a new police headquarters building, and building on the science, research, and educational district centered on USF St. Petersburg and Bayboro.
Through the use of our windshield survey as well as research, we found 6 prioritized selection needs of this community. Problem number 1 was cancer, which is the leading cause of death in St. Petersburg for individuals, attributing to 22.8% of deaths annually, according to the U.S. Census. This percentage is believed to be due to the increase in the usage of tobacco as well as prolonged exposure to UV rays, as Florida is the sunshine capital of the world, home to many popular beaches. Priority number 2 was alcohol use. Florida, specifically St. Petersburg, is notorious for being a popular traveler's location. The relaxed atmosphere mixed with beach vibes, in addition to the plethora of bars made available, tempts people to drink, many times in excess. Priority number 3 focuses on education on healthy living. Teaching the importance of dieting and exercise must be prioritized to prevent diseases that can occur from poor dieting as well as sedentary lifestyles. Diabetes and heart disease are examples of 2 diseases that we can help prevent by living a healthy, active lifestyle. There are a handful of gyms within this vicinity, as well as parks and recreational centers made available to those who so choose to join them, as well as free biking walking trails. Priority number 4 focuses on STI education. According to the Florida Department of Health, approximately 3% of the population will die from STIs annually. Sexual education is not readily offered by many schools within this vicinity, and if it is generally a brief section of teaching, and the importance of safe sex is not stressed. By providing education to our younger population as well as continuously educating the older population on STI prevention, we can help to decrease the quantity of people who obtain STIs. Priority number 5 focuses on dementia and Alzheimer's disease. Florida is well known as being a retirement retreat. Baby boomers are increasing in age, requiring the need for more nursing assistants. The U.S. Census states that 15.7% of the population are over the age of 65, many of which suffer from health complications related to dementia and Alzheimer's disease. The 6th and final priority we discussed was schools within St. Petersburg having a bad reputation. The average rating of the schools within this vicinity is a D according to the Pinellas County school systems. Without a solid foundation for education, children may not progress to the fullest of their abilities in the future and may view education as a waste of time, money, and effort.
When looking within this community, we see that there is an increased number of respiratory issues. These issues are due not only to tobacco use, but also pollution due to the concentration of people living within this peninsula. When looking at China, we see that there also is an increased number of population and pollutions and respiratory complications due to the smog and other polluting factors. Within their society, they're fixing this problem of pollution with warnings as well as air buffers. We can do the same within our society, and hopefully we will not get as bad as them.